The weather is getting cooler, the 10-miler is almost here, and lots of people are heading out, hitting the trails, walking and running. And nothing can slow you down like nagging foot pain. And surprisingly, there are over 70 different problems it could be. So I headed out to the experts at Rehab Associates to learn all about it.
Plantar fasciitis is kind of used as an umbrella term for most people. So we kind of see a lot of patients who are diagnosed with plantar fasciitis, and a lot of people will label that as any pain on the bottom of the foot. There are actually 72 different causes for heel pain, and one of them is plantar fasciitis. So when we're talking about plantar fasciitis, we're talking about pain that's more in the middle of the foot and kind of right underneath the arch. A lot of people that we see come in and they have more pain that's directly at the heel, and we would label that as heel pain syndrome. The important difference for that for us is when we're talking about heel pain syndrome, it's generally more of a muscle pain than it is a ligament pain, and we kind of treat that a little bit differently, so it's important to make that distinction in terms of how we would treat that person.
And what causes this?
So there's kind of a number of different causes. Typically we see this more often in people who are in the 4th and 5th decade of life, and so there has been some soft tissue breakdown of those muscles, of that ligament to an extent. And usually that's coupled with a change most of the time. So they had a change in activity level, like somebody who decided that they wanted to start a walking or a running program, or they changed their shoes, or they changed jobs. So usually there's something that has occurred that has kind of started this, that if we dig a little bit in the history we can tend to find. And then a lot of times it's people have their own biomechanical issues in terms of alignment of how their foot is made, and that's going to play into the course of how this can be painful for them and where the pain is.
So then what are the treatment options for it?
So a lot of times what we're looking at with true plantar fasciitis or even a heel pain syndrome is that a lot of people have really, really tight calves and stiff ankles. So if your ankle can't bend here, it's going to bend here. And if the muscles in the plantar fascia attach right underneath it and you're pushing on it, that starts to hurt. And so a lot of treatment in the beginning is focused more on getting that ankle to bend in the right spot, getting that calf to lengthen so that we can take pressure off the bottom of those arch muscles and that plantar fascia ligament.
And we did some different stretches. We had somebody show us an example of this. What were we seeing?
So what we were seeing is two different types of stretches. So one of them was a dynamic stretch, and that is a great stretch to do as a warm-up. So what we're doing is putting that calf in a stretched position, but we're not moving it to end range, and we're moving in all 3 planes of motion with that stretch. So it's a great way to warm up before you're gonna go for a walk or a run, because it gets that muscle a little bit looser to redirect the stress. And then the other stretch that we showed was kind of a wedge stretch, or a typical runner stretch with a wedge, and that's a static stretch. So that's a stretch that you're gonna hold for a length of time. I tend to hold for at least 30 seconds, upwards of a minute, and that's gonna put that joint into the end range of that joint and allow that muscle to really stretch deeply. But it's best to do that at the end of an activity after you're all warmed up, because you get the best stretch that way.
And then let's talk about hardcore training. And if somebody hurts themselves bad, when do they need to come and see someone like you?
I tell people my general rule of thumb is 2 weeks. If your body's going to heal itself, it's generally going to do it in about 2 weeks. If you're having a persistent pain longer than that, it probably needs some help. And a lot of times, most people will kind of put that off and give it more time. And then what we start to see is they started off with some pain on the bottom of their heel. And so then they kind of started walking around that heel. And so now their knee hurts, or their hip hurts, or their back hurts, and we're trying to figure out what the true cause is, versus if they just came in when it first started hurting, we could fix it relatively quickly. You're talking about, 2 to 4 weeks, and somebody could be a whole lot better if we catch it in the very beginning and treat that and get that ankle moving in the right direction.
And with the 10-miler around this time of year, do you tend to see a lot of folks with foot pain?
Yeah, we see a lot of people who may not have been as diligent in their training program, which it happens, life happens, we understand that. And so they might, go out and run that 10-miler, or the 4-miler course is no joke either. And then they wake up Sunday morning and they have some terrible pain. And so a lot of that is because their joints were not accommodated to that stress. So what we find in general exercise, and in running in particular, this applies really well, is that your cardiovascular system, which is your lungs, your heart, those things tend to condition a whole lot faster than your bones and your joints and your ligaments and your tendons and your muscles. And so it's usually about a 2 to 3 week lag for those. So if you're ramping up a particular activity too quickly, you might not know that you have injured something until you've done some true damage, because those joints and those tendons and those ligaments aren't accommodated to that stress yet. But heart-wise, breathing-wise, you feel okay. So that's where following a training program is important to kind of minimize that risk for injury.
And we want folks to know you don't need to suffer. You don't have to go to the doctor before you come out to Rehab Associates. You all are experts in your own fields, and you can help treat foot problems.
Absolutely. So in the state of Virginia, we have direct access, which means that for most insurances, not all, but most, you can self-refer and come to us, and we can see you and get started on treatment for this problem right away. And if we feel like you need additional services, you need to go see an orthopedic doctor, you need a series of images on that, we can certainly send you to somebody who can order that for you, but we can be the first line of defense to look at that and generally get your treatment started a whole lot sooner and get you well without having to go through all of those other steps, which saves you time and money and makes you feel better faster and get you back to doing the things that you want to do.
To get help with foot pain or whatever else ails you, Rehab Associates of Central Virginia can help, and they have many area locations. To learn more, give them a call at 855-RAC-4PT. Find them online at racva.com or check out their social media pages.